refreshing sleep, catnap sleep, quick to act after awake, walking in sleep, salivation in sleep, grinding teeth in sleep, desire sweet, soil, indigestible things, buttermilk. This is gathia is Indian, what we call Gujarati food. Gathia, bhajia, dhokla, everything is Gujarati food. So he loves that. Cream biscuit, ice cream, jaggery, aversion to ghee, milk, malai, thermally hot. A very obstinate child, angry but timid, weeping, salivation from mouth, diligent and conscientious in study, very studious, like to do homework. I got 84% in first standard. Like drawing and painting, artistic, like to play with the mobile games and toys. No fear, like to light up crackers in Diwali, but after he got injections on scalp for baldness, since that he had a fear of doctor. Like to see ghost movie and cartoon, like to wear clean clothes, never make clothes muddy while playing, like to remain neat and clean, fastidious, even he put his books in bag according to his school timetable. Like to play skating at the age of 2 years when he got staircase, goes to staircase, he stop and go up and down very carefully, very cautious, precocity, fear of darkness, like maths, drawing and PT subject. So what could be the analysis? The dispositional analysis is this: the angry child, artistic aptitude, very cautious, weeping, desire for indigestible things, hot, thirstless, and desire sweet. So on the basis of this, I took this rubric. Which remedy to be prescribed? Only two remedy in the hand: Silicea and sulfur. Absolutely, Dr. Farhan. So same way in 2013 I had that limited knowledge. Sulfur has prescribed. Okay. After some time, the patient was not improving, but GC was good. General condition was good. So I waited. Okay. SL. In the follow-up, what mother said, one thing mother told that he liked to wear girl slipper. Very important. So this is what pop up. Something is popping up. Same like the teeth. Psychosis and something is popping up. So mother said that in the follow-up history, absolutely, Dr. Nisha. That is what the thing is. What I am failing is the case, and then I change the remedy. Very important. Dr. Sunita, identity conflict in 2013, I don't know. But right now, if alopecia patient comes, I will ask about identity. Absolutely right, Dr. Sunita. But in 2013, what I need to understand that what syphilis is popping up. So in mother is saying that he like to wear girl slipper. That is very important. So on the basis of that, I understand that this is something that the child is behaving like a girl. So at that time, what we learn is manage and effeminate. At that time, we don't understand about the confusion of identity. So I put query effeminate. So I took the rubric again, reconstructed the totality, effeminate as a syphilis, artistic aptitude, hot, thirsty, and conscientious. So on that base, the remedy come was silicea, but patient was hot. So what we learn in earlier days, whenever you can have a diligent remedy like silicea, but the patient is hot, you can think of carcinosin, you can think of lycopodium, you can think of iodine. Okay, so at that time the thermal thrust is very important. So I strictly stick to the hot, and on the basis of that silicea was there, but my hypothesis is I prescribed carcinosin. Okay, so carcinosin was prescription given. After carcinosin the weight was reducing. Okay, and the alopecia remains same, no improvement. Now what to do? Again weight was reducing from 18.7 to 18 kg. Got diarrhea and involuntary diarrhea in the pant. So again the syphilis is not cover. Okay, great. Remedy is very easy to pick up. Child become more obstinate but mild need said by the mother. સવારે જ કપડા પહેરવા આપે તે પહેરી લે, જીદ ના કરે, but he is obstinate. Weeping from scolding slightly and involuntary diarrhea. Okay, so again I go to the syphilis. What syphilis is there in previously? He like indigestible things. I took desire sweet, but at that time I didn't take. So this is what another pop-up. One pop-up is effeminate continue, then desire indigestible things, aversion to milk, artistic aptitude, and desire for warm food. What remedy comes into your mind? Whenever hot food is there, warm food is there, the remedy comes into mind is lycopodium. All are agree with this. Okay, but the repetition does not show lycopodium. Then even after 7-8 remedy, no lycopodium is there. So lycopodium is straight away ruled out. Okay. And the remedy, see, that is what the repertory gives you idea. Our limited mind will tell that the lycopodium is the remedy. But what repertory ruled out? No lycopodium is there. Even warm food, silicia is there. Very good, Dr. Misbah. We need to think of calcarea iode. Very good. Fine. So I change from thermal to syphilis. Thermal is misleading. You know, psychosis is always misleading. So sometimes you have to loosen the psychosis and pick up the syphilis. That is what the pop-up is. My idea of putting video is this. Okay, so I forget the thermal and I prescribe silicia because what mother says, he is obstinate and also yield. So prescribe silicia 1 m. His weight was increasing from 18 kg to 19.1, then 19.5, and there is an improvement in the lesion. So this is shows that the remedy is covering the syphilis. Whenever you are picking up the syphilis, it will cover everything. It is not hard and fast rule that you do not consider thermal in syphilitic cases, but you can have the thoughts like Dr. Nisha has said that take home message. Sometime you have to loosen the thermal in syphilitic cases because syphilis is very important to pick up. Okay. So this was the case. So hope you can understand this is the better. Again, the another case of same alopecia, I will skip this case because in this case I will show you what I took is simple hunger aggravations as the entry point. Patient was timid, introverted, frown disposed to, irritable, angry, haughty, and having. See, I will show you this analysis. Hunger aggravation as observation, puffiness, lower eyelid as observe, and startle easily. This is what in earlier stage, what I learned from Vijay sir, that you take the syphilitic general rubric and enter through that and apply. So in that case, I took this. Okay. So the repetition chart is this: hunger aggravations, eye swelling, puffy, startling, and sweet desire. So on the basis of ferrum, phosphorus, and sepia is the come. So on the basis of that, I prescribe sepia to that male patient. And why I am skipping, because this is what something I am giving you more important after that. So this was the first, followed by change, followed by more change, followed by absolutely normal. This is 1 year follow-up. Huh? Look at this. From this to this. Okay. Now, Kara, repertory is Kara. Sepia 200 was given throughout 1 year. No repetition has been done because hair is growing gradually. So no repetition has been done. Okay. very important case is now the understanding of evolutions, that this was the case of 2013. That's why I took general syphilis, I took some pop-up syphilis. Now you have to evolve and add the conflict into your cases. So I will share with you a case of this. Okay. So case of tubal block. Generally, I used to get a lot of cases of infertility in my clinical practice. So I used to have this case, and let's see what is the. So the case came to me, a 31-year female housewife diagnosed with the secondary infertility due to right-sided tubal blockage. Investigated in Jan 2022, HSC shows right tubal block. Patient came with the complaint of not getting second pregnancy, difficulty in conceiving, and she had took many hormonal treatment and even underwent IVF but didn't successful. That's why the patient comes to your clinic. Okay. So this was the report. Shows right cornwall block, right-sided tubal block. So patient with regular menstrual history, lasted for 3 days. It was dark in color, thick sticky discharge, no clots, mood changes, dullness, no desire to work, irritable, little bit of leukorrhea during ovulations, and offensive odor. I asked about the sexual history. So she said that right-sided Bartholin cyst last month. And in Gujarati, she said that how many of you are Gujarati in this session? All are comfortable with Gujarati? Otherwise, I have to change
No,
the.
sir. It's a mixed
Okay,
crowd. We have from South also.
okay. So I will make it in English.
Yeah.
So what she said in Gujarati, that she doesn't like to have a sexual relationship. Sometimes she feels that have a sexual intimacy, but she doesn't like much, and she don't have interest or loss of libido, what we called as. Okay. So sexual desire was diminished, but increase in afternoon. There is a dryness of vagina with the pain and burning, no desire for foreplay, constant fear. There is a fear that something is there in private part, or it might cause pain, and there is a spasm in that particular private part. So that was a constant fear and sensation in that private part. That means vagina. So 3 months back during intercourse process, what happened? I asked about why this is happening. So she said that 3 months back during the love making process, suddenly her daughter got wake up, and after that she got shock, and she constantly had the fear that she might wakes up when we are making intimacy. So this was the fear. She again says that she had a fear when examinations during the gynecological examination as well as the USG. So she had a fear of examination of vagina, and the lady says there is a spasm in vagina. What was the interruptions? I don't understand. Yes, interruptions by that waking of the daughter. Yes, that causes the fear. So past history, right tubal block, lateral forehead injury, abscess behind ear in the childhood, typhoid in the childhood, LASIK treatment for myopia, and the B12 deficiency. Then I asked about the life space. She was born in the village, the first standard. At first standard, she came to the Surat. She is weak in study, very fearful about the ghost. And if anyone talk about the ghost or this is the black things, she got fear. And sometimes she used to have a perception that she might see the ghost. Okay. She had one child, parity one. This was a female child, 7 person in the family, husband, patients, mother-in-law, father-in-law, brother-in-law, sister-in-law, and her daughter. Uh, I asked about what was the environment in the family. So she said that everyone in the family is angry in nature, and she used to scare about their nature. Okay. Someone is scolding in a small matter. She got fear that they might criticize or they might have scolded her. So this is what the fear had. Then I ask about, see, now the history is there is two things is there. One is tube is blocked, and second one is she said that during the case taking, during the sexual act, there is a spasm in the vagina. Okay, so one thing is body is not allowing to enter into. Okay, so that is very important. So I ask about the fear. So the patient says that I have one daughter and I don't know, I don't want daughter. So she wanted to conceive, but she said that I have one daughter and I don't want another daughter to come. So I ask about why. Now the conflict study we have evolved, so we have to understand that. So patient says that in this time of era, very things is we cannot brought up a girl child. It is very difficult because in this era of time, many incidents happen in the society like a rape, and that lead that kidnapping, raping, and this lead her to a fear. Actually, nothing is happening, but this is what the fear in her mind. She said that in her group of friends, all have two children, but marriage nothing. That was the envious part of the persons. Again, she is very sensitive, so she is sensitive to small matter, and she have argument with the sister-in-law, and after sister-in-law giving you some retaliate back, she got tense after that. She is always taking care that nobody criticize her, so she is like doing something according to others, nobody want to criticize, so she always says koi મને કઈ કહી નહીં જવું જોઈએ. Okay, so reaction was, so she said that I don't want to speak much, even I don't like, then also I don't want to speak, I don't express, even I have anger, I don't express. Okay, and where is she expressed? She expressed that anger on her daughter because she don't want to have a quarrel in the family and she don't like that. So this is what the sensitivity is. She said that we had done a lot of treatment, a lot of pregnancy related treatment, but nothing helped us. She said that first pregnancy was conceived very easily, but during second pregnancy it is very difficult for us to get the pregnant. Okay, and every time whenever she used to have a menstrual date come near, she used to have a tense that I would get menses, and suddenly it happens. So this is what the case is. Now, what was the analysis of the case? We need to treat tubal block. Okay. So first and foremost things, we need to allow fear of misfortune. Yes. Again, the case is a psychosyphilitic. Okay. Patient came to us for the conceive, but we need to open up the path for conceptions. If we cannot open the path, conception could not happen. Okay, so the path has been blocked, so we need to find out the perceptions which block the path. So what could be the thought process? Fear of misfortune, fear of fright remain, dryness of vagina, delusion, injury will receive, so we need to find delusions. Harmony, desire for, emotion suppress, quarrel, aversions. Yes, natram your Dr. Misbah. Very good remedy for infertility. Okay, the process which we have learned in nowadays is this. So we have to understand the conflict. So according to GNM, the conflict related to the fallopian tube is a gender conflict in which the ugly conflict with the male. So always there is a conflict with the male. Okay. So ugly conflict with the male leading to this state, feeling of humiliated by men, either physical, sexual, emotional abuse, verbal insult, disrespectful treatment by the partner, spouse, male relatives or friend, offensive behavior of the colleagues or harassment by the former boyfriend, ex-spouse, ugly divorce, male authority, supervisor, doctor, judge, policeman are possible conflict scenario, and distressing gynecological exam could also provoke the conflict. What we find in the case? We find in the case everything is there. All family member are angry. She is sensitive. Even gynecological examinations is not able to, and she has a fear that this might happen in the child. We have to bring this child, so we have to be very careful. So what could be the rubric from this? This is what the we have to understand the conflict. But what could be the rubric we can think of? Delusion injured being, delusion misfortune, yes. Fear question rape of, yes, very good. Fear fright remain dryness of vagina, good. Anything else? What could be the rubric for this? So let's explore this. First is fear rape of being. Very important. Why my body is not allowing to open the vagina? There is a constant close of the vagina. That means I might take the advantage of this. So this fear causing spasm in the vagina. Even gynecological examinations also provoke this. That is what the fear of being raped. And the perception at the level of mind she had, that she feels that in nowadays, what is this happening in the society, that they can have a rape, they can have advantage of the female, and they can kidnap the small child, even though nothing is happening. But she has that fear. So that is what fear of being raped. Okay, first rubric. Second, what she said, that during coitions she had that spasm. So spasm coition during, that is vaginismus coition during. Third one is vagina painful coition during. This is what the patients perceive. This perceptions leading to only one remedy. Someone has said this remedy rightly, Dr. Bharat Reddy. Absolutely right. The remedy is creosote. Okay. Now you need to understand, does the creosote will have affinity for the tubal block? So whenever what I learned from Vijay sir, whenever one ophidia come into your repertorization, you can think of all ophidia. If the lachesis is there, you can think of Crotalus viridis, Crotalus cascavella, Nasa, Shankris, Elaps, and everyone. Even one aurum remedy is come into your repertoire, you can think of aurum salt. As we have seen in as per medicine rubric, calcarea is there, and we prescribe calcarea iode on the basis of that. So in that case, what I learned, that this creosote is the carbon remedy. So remedy which is from the carbon group and having affinity on the tube, that has to be taken into consideration. So the sphere of action of carbon remedy, the rubric is tubal disease chronic, and the remedy is Eupion, and the medicine is prepared from the wood tar. Hope you got this understanding. The remedy is Eupion. Okay, so I had prescribed Eupion 30 weekly for 3 months. Okay, Eupion 30 weekly for 3 months. After 3 months, the painful coitions, vaginismus, all are reduced and sexual desire was improved. That means what? Our medicine has removed the mental perceptions, and after the removal of the mental perceptions, the body reverse back to the normal thing. So I need to remove the block. So I had removed the block with the Eupion and advised HSG. After 4 months of treatment, the HSG shows bilateral patterned fallopian tube. Okay. That is very important, that when the fallopian tube is open, when the patient's cohesion is improved, that suggests that you have removed the perception of the patient from the mind. When the mind perception is removed, the body follows. What we learn in aphorism number footnote 9, that imaginations of the mind can create the disease, and if it is removed, can cure the same means. In a creosote, if the lady having a severe offensive discharge with the cervicitis and there is a rapidity, putridity in the discharge, then I would prescribe, but it is not in that case. Okay, that's why I had prescribed Eupion on the basis of carbon remedy and having affinity of the tube. And after this case, what I learned is, in a 4 cases of tubal blockage, I had experimented with Eupion 30 weekly for 3 months. If the HSG got not normal, then I would think another remedy. Otherwise, I directly prescribe Eupion. This is what my clinical understanding is. Okay, you can apply this knowledge in your practice and let me know. Okay. Wait, Dr. Surbi, delirium sepsis will come at the end. Still, it is not the end. Still, we have the cell psychobiodynamics. Okay, fine. Now we move to the another aspect of learning, that is, up till now we have covered the syphilis. Then this is autoimmunity. Okay.
I came across a fallen tree. I felt the branches of it looking at me. Is this the place? I came across a fallen tree. I felt the branches of it looking at me. Is this the
What you learn from this video? Hope all might get not sleep.
Just we need to change the direction, sir.
Yes, exactly. That is what we have to do in autoimmunity. Perfect. Okay. So what we need to take into consideration in this case? Let's say one case, we are having a case of scleroderma, a 41-year female, married, studied up to BSc Micro, PGDMLT, a doctor's wife. Few years back, she was a teacher in the school. Since 2 years, now housewife. The case referred to me with one of my homeopath friend and diagnosed case of scleroderma. It was in December 2023. Okay, the complaint started with the joint pain, then fever, then muscles pain, then mouth ulcer, FT, then rash on the body, and then joint pain continue. The cycles continue this way. The problem in walking due to joint pain, movement of the joint difficult, side changeable, sometime right side, sometime left side. There is a stiffness in the wrist, finger joint pain aggravated in morning, sitting, unable to rise from sitting and need support. As she is a wife of Medico, she was prescribed Arnica 30 OD for 5 days. After that, complaint aggravates. Another complaint, she had skin complaint for 6 to 7 years. Every year, eruptions on the neck, upper part region, groin, breast area, itching, especially aggravated in summer, aggravated in perspiration, taken antifungal medicine lot of time. But one of my homeopathic friend who had prescribed Apis and Bryonia for inflammations and redness of the mucous membrane of throat and vagina, which did not help her. Another complaint is irregular menses since last 3 months. During menses, 1 to 2 days severe abdominal pain, flow normal. allergic rhinitis, and the investigation is this. It was on 2nd December